I'm Dr. Jay Greenspan. I'm chairman of the Department of Pediatrics at Thomas Jefferson University and Nemours Children's Clinics, the A.I. DuPont Hospital for Children. Here at the Jefferson Hospital, we have about 2,200 deliveries. Many of them are high risk. We also transport in about a third of the babies here at Jefferson. We have many kids less than 1,500 grams, but we also provide term babies with head cooling as needed, ECMO, and surgery, so a level 3+ nursery. We have about 800 admissions a year, and our average length of stay is about 15 to 20 days, depending on the type of baby. So we have an average census of around 35. All the technologies that we need to help care for them, including a great nursing staff, several full-time respiratory therapists here at all time, and of course a great attending resident and fellow staff. We're going to be talking to you today about thermoregulation, particularly as it has to do with the preterm baby. The purpose of this talk is really to go over some of the basic physiology that you need to know to adequately care for these babies in terms of their heat needs, and talk about some practical considerations when you go to warm these babies, particularly the very small preterm babies. And at the end, we'll talk somewhat about recent research and considerations for your clinical management of those babies. So when you look at thermoregulation, most of us who work in the NICUs really view this as a routine, something that is taken care of mostly by the non-physician staff. It's managed by the nurses, by other therapists that will come by, and it's really almost a second nature thing for us. It's something that is often not even in the order set, that it's assumed that a baby will come up and thermoregulation needs will be met by the team. And the team, meaning the nurses and the other staff, will put the baby in the proper situation so that they're thermally regulated. In fact, when you look at the history of neonatology, you'd find that heating the baby, particularly the preterm baby or the small baby, is the single most important thing we've done to improve survival of the preterm neonate. It's something that started really in the 1800s with the understanding that babies needed to be warmed, and the babies that were warmer survived. And it went on into the early parts of last century when you may go to a World's Fair, for instance, and see these small babies in incubators or little warming environments, and it would be sort of a wow moment. Here's a very small preterm baby in an incubator, and isn't that cool? And in fact, what we were doing was allowing the babies the time to mature and keeping them warm. So thermoregulation has been a critical step in improving infant survival over the last 150 years. And it really became refined in the 50s and 60s when incubator technology started to improve. And if you look at survival of preterm neonates in the 50s, there was a marked improvement, really almost solely due to incubation technology. Because if you think about it, the next big step in care came in the late 60s, early 70s, when we started to ventilate babies and provide continuous positive airway pressure, et cetera, and oxygen therapy that allowed the next step in survival. But that had not occurred in the 50s and 60s yet, and so survival really was very much related to our ability to adequately maintain babies' temperatures. Thermoregulation is where it all started, and this is the single most important thing we've done to save babies' lives, and it continues today. I think we take it for granted. It's something that the nursing staff does without us really even paying attention to it. But we've learned that it's an incredibly important technology. It's important to maintain a very stable, carefully determined environment because it impacts on the long-term outcome. It's time to relook at this technology and our approach to thermoregulation because it does impact on how these babies do. As we get better and better at caring for babies, this is something that we have to reconsider and relook at and fine-tune for the best care of our babies.